children's residential services have been, as you can imagine, impacted significantly. I suppose in relation to the young people, you know, life was going on as normal and day-to-day expectations were as they would be. And then all of a sudden, in their view, their world completely changed. And one of the big challenges at the start was how we help the young people understand, because for all of us, you know, every day in March brought a new, you know, surprise, shock, trauma, and the same then for the young people. So a lot of resources went into trying to help them understand and come to terms with their new way of living.
I mean, the families that I work with, their children, they can't typically just take them out to a park without an extensive amount of planning. And they rely on a wide range of services across schools, across short breaks units, across support workers to keep them afloat. And all of those have been lost. And children with autism have really high baseline levels of anxiety anyway, and they rely on structure and routine to help them manage their anxiety. So we've seen a massive spike in children's anxiety because of the lockdown. They don't understand what's happening, and it's placed a huge strain on families at this time. And the social workers and the nursing staff that I work with have been really heroic throughout all of this, because the children that I work with don't understand social distancing. And you can imagine
that's all children, isn't it? I don't think any children understand social distancing.
Yeah. So you can imagine, particularly older children with autism and learning disability whose behaviour is very challenging. Particularly in the inpatient unit that I work in, the nursing staff have been absolutely heroic throughout all of this, and working with those children and remaining compassionate towards them. So it's been quite humbling for me.
Yeah, and it's evident up and down the country, I think, how brilliant the frontline staff have been in terms of answering the call, and it's indicative of all of them that they're so determined, so dedicated. They don't want to let anyone down, least of all their colleagues, by giving them more work to do if they have to take time off. So I am worried about everyone's long-term health and kind of the implications of that, because it's a hard enough job as it is on a normal day, let alone the circumstances that you're all facing at the moment. I'm particularly worried, Francis, as to how the young people are going to cope, you know, long term, because I think we're all muddling through this period at the moment and helping each other, but the long-term implications of school being missed, anxiety levels, family members, you know, sadly dying, and the sort of general maybe economic outlook. Do you think that's going to play heavily on your services and what people are going to need?
Yeah, interestingly, in our service in the short term, some of our referral rates have gone down, but I would imagine as we're starting to come out of lockdown and people starting to get back into the world again and starting to realise just what we've been through, I think that we will see our referral rates increase and the impact on services. What I think has been really helpful is that a lot of work has been done to try to think about how young people can care for themselves, how parents can care for them, to help them to survive and to thrive even through the pandemic. But I think it will be on the other side of it. We'll really have the challenges that you mentioned.
Without a doubt, older people living in nursing homes have been infected by the pandemic, so they have, and that has created a lot of challenges within the care home sector, both with families not being able to visit, but then with people dying and loved ones not being able to spend time with them prior to their death and the way they normally do.
And Natalie, is there a sense of anxiety and concern around a lot of your staff as to the responsibilities they now put on them to keep the virus out of homes and places like that?
One of the challenges of the pandemic is that because of the asymptomatic nature of some people carrying the virus, it can be in the home before anybody presents, and then multiple people will have been infected. So trying to contain that spread of the virus, which has been very challenging. Staff are very, very fearful. They are, in terms of both getting the virus themselves and carrying the virus home to their families. So usually when it gets into home, what we've seen is 24 homes in Belfast so far. or have been affected. And usually when the residents are affected, then staff are affected. So putting the support in terms of an in-reach team to actually work in the homes, which wouldn't be normal for us, has been crucial to continue service delivery. And then just managing the psychological and emotional support to staff as they watch people they care for on a day-to-day basis dying, and that's been very, very difficult and emotional for staff.
But it must be very difficult not providing or not being able to provide that human touch, that kind of face-to-face care. It's very difficult when you're behind a mask and goggles and aprons.
Yeah, I think particularly for children with autism and intellectual disability, they who often have, a lot of the children I work with are non-verbal, so they don't communicate verbally, and they rely a lot on looking at your face to communicate. So in the inpatient unit that I work in, the staff have been very creative and have taken big smiling pictures of themselves and then pinned those to their front so that the child knows what they look like underneath the mask. So it's encouraged a lot of innovation, I guess, as well.
Our staff have bought huge big teddy bears, especially for the young people who really need hugs and come in to, get touched and feel. So we bought teddy bears to help them, if you want a hug, here you go, and the hug the teddy with the staff beside them. So it's been interesting, but as you say, Claire, staff are coming up with really innovative ideas and throwing them out. We're running with them, and they're absolutely working.
Everyone needs a hug, Emma. Very important.
They do, sir.
I would just like to say before I go that I'm hugely grateful for all you're doing, and I hope enough people are saying thank you and appreciating all the hard work that not only you but all your teams are doing right now. I know it's unprecedented, I know it's quite scary and it's daunting, but you're all making a huge difference. You really are. And so please pass on to all your teams how grateful everyone is and how appreciative everyone is for everything they're doing at the moment.